So as I told you before, one of the things that people can often do after they've experienced a trauma is try to avoid thinking about what happened or talking about what happened. And although that seems kind of logical, it actually hinders people from being able to get over what happened to them. So one of the most important things that we would do with Jenny, if you guys choose to do this kind of therapy, is we would have her retell the story of what happened again and again in session until she can retell what happened without getting really upset.
Okay, I'm not sure I understand though. I just kind of want her to move past it. How will telling the story over and over help her?
Yeah, I totally understand why you would be concerned about this, but it is actually the most important and the most helpful part of this therapy. And the reason why is that it will actually help her to process the emotions in session so that day-to-day reminders or thoughts of what happened won't make her become as upset, and then she won't be as likely to try and avoid certain places or things or people. And it just also helps her feel like she's in control of her emotions and able to move past what happened.
Okay, will I ever hear the trauma narrative?
Yeah, that's a really good question. So once Jenny feels comfortable sharing the story with me multiple times without getting upset, I will share with you what happened without her in the room. And then over time, as you can hear the story without getting upset, Jenny will share it with you in a session where the three of us are all present.
Wow, that sounds really difficult, but I'm willing to try it.
Okay, so once Jenny is able to go through the trauma narrative and remain calm, we'll start identifying what thoughts and feelings she might be having that are unhelpful and cause a lot of emotions and reframe them. So common themes that can come up for kids are feeling like they're responsible for what happened. They can have a lot of feelings of shame, and then also kind of just like general changes in trust for people overall, just to name a couple. So we'll kind of just talk about those and help her through those, and also it'll be important for us to talk about any strong emotions and thoughts you're having, because that can happen for parents as well.
Yeah, I definitely feel responsible about what happened to her, and I think she feels unsafe sometimes. I can see her get anxious or agitated in situations where maybe it doesn't call for it, but I just don't know what to do when that comes up.
Yeah. So cognitive processing can definitely help with your emotions and hers as well, but also we have the next phase of therapy will kind of help you manage her behavior at home when those strong feelings come up.
I informed my psychologist that following the trauma, Jenny was dealing with behavioral issues for the first time in her life. The psychologist reassured me that children often react to traumatic events with anxiety and emotional outbursts. She also told me that other common reactions include disruptive behavior, aggression, anger, or having trouble following rules. The psychologist told me that in the behavioral management portion of therapy, several strategies would be introduced that would help me deal with these kinds of behaviors when they come up. The psychologist informed me that behavior management techniques help parents make desirable behaviors, like following the rules, more likely to occur, as well as making less desirable behaviors, like acting out, less likely to occur. She said that we achieve these things through the use of praise and things like time out. She also told me that although it might feel difficult at first to punish Jenny for the undesirable behavior due to the trauma, that it's an important part of recovery. I agree that setting firm boundaries and discouraging the disruptive behavior is going to be important for Jenny's prolonged success.
As I mentioned earlier, there will be a point in therapy at which Jenny is going to share the trauma narrative with you while the three of us are meeting together. And we include this in the therapy for multiple reasons. One, it's an important opportunity for Jenny to be able to share the narrative with you so that she can see that you're responding and being able to talk and hear about it in a calm way, and so that you can model effective coping for her about what happened. Mm-hmm. It also gives you both the opportunity to clear up any misunderstandings or confusion about what happened and any emotions that might be stemming from that miscommunication.
Okay, does this mean that I should be talking with her at length about the trauma outside of therapy?
Yeah, that's a really good question. And although that is the eventual goal of therapy, we kind of discourage parents from talking about it early on in therapy because we want to make sure that the communication is healthy and productive and that effective coping is getting modeled. And we just want to make sure that you're both comfortable communicating about it before that happens.
Okay, that sounds good.
So do you have any other questions or concerns that you want to talk about in regards to this therapy?
I don't think so. You've done a really great job explaining it, and thank you for meeting with me. I feel like I have a much better idea of what our options look like.